COVID-19 has made people more sensitive to nosocomial infections in dental clinics. In particular, patients with certain diseases take anti-infective drugs before going to the clinic. The risk was already warned by CDC in 2003, based on the recognized facts. Patient material such as oral microorganisms can enter the dental water system during patient treatment. Microorganisms colonize and replicate on the interior surfaces of the waterline tubing and form a biofilm. A biofilm serves as a reservoir that can amplify the number of free-floating microorganisms in water used for dental treatment. And CDC set a target of less than 500 CFU per milliliter for the number of bacteria in water used for non-surgical dental procedures, and as strategies to achieve this. Flushing devices. Use of chemicals. After COVID-19, 2024 ADA report set the same goal. Surprisingly, however, the main strategies have not changed in over 20 years. Why is that? Because biofilms are difficult to remove. Biofilms are protected by a polysaccharide slime layer and are very tough. During flushing, some of the biofilm may peel off, but the bacteria will quickly regenerate the biofilm. A 2017 report from Japan found that the closer to the handpiece, the higher the number of bacteria and the lower the chlorine concentration. It proves bacteria observed in the waterline of the dental unit enter from the handpiece side and form biofilms. Even if a chemical is injected from upstream, the concentration will decrease as it reaches downstream, making it difficult to sanitize the biofilm. Considering the above, it is difficult to remove biofilm using only the previously recommended strategies. As long as biofilms are present, no matter how clean the water upstream, the water that is passed through the bacterial colonies will be contaminated. So what should we do? Physical scraping of the biofilm, like brushing teeth, is effective, but the tubes used in the waterline of dental units have narrow holes, making brushing impossible. However, a physical method for removing biofilm has been developed in Japan. It is a nanobubble water generator, Dr. Nano Mini for dental. What is nanobubble? The cleaning and peeling effects of bubbles have been known for a long time. Nano-sized bubbles are extremely small, as invisible, and change the character of the surrounding water, have the power to penetrate dirt or biofilms and peel them off the floor. We will introduce 3 evidences of nanobubble. Evidence 1, demonstration test, in vivo. Immediately after implementing Dr. Nano with dental units, colored water may be discharged from the waterline. This is the biofilm that was attached to the waterline of the unit and was peeled off by the nanobubble water and removed by flushing. Evidence 2, biofilm removal test using nanobubble water and tap water, in vitro. The comparison test was conducted between nanobubble water and tap water as control, using a strong artificial biofilm. The differences in behavior are observed. Tap water can only be scraped off the surface of the biofilm. Nanobubble water circulates between the biofilm and the pipe surface, peeling off the large clump all at once. Evidence 3, comparative demonstration test, in vivo. At 10 dental clinics, each of 10 water samples were collected from the syringes of the units with Dr. Nano implemented more than 1 month ago and without Dr. Nano as control. And we then compared the number of viable bacteria in 2 samples at the same clinic. The results showed that bacteria were observed in 90% of the control samples, while no bacteria were observed in the samples from the unit with Dr. Nano implemented. Features of Dr. Nano. Dr. Nano was designed for use with dental units and efficiently generates nanobubbles using only tap water pressure, even with the low water flow. After the implementation, nanobubble water is constantly filled in all water lines, so during clinic close time, existing biofilms are removed, and new invading bacteria cannot easily create a biofilm. Using Japanese precision processing technology, the length is shortened to only 1.6 inches, 40 millimeters, making it easy to install even by DIY. Because nanobubble is a physical measure, it can be used with chemicals. As long as the biofilm is removed, chemicals can sanitize the naked bacteria. Therefore, even if chemical measures have been implemented, they will not be wasted and moreover work a synergistic effect. The unit price is below 50 cents a day, 5-year warranty. No running costs as it does not require electricity or consumables. Maintenance-free due to no parts that break. Please consider Dr. Nano Mini for dental, which uses a world's first new technology.